Hello and welcome to Practical Medical Science YouTube channel. In about 10 minutes, we will discuss scientific data on hot topics in medicine with practical recommendations for your everyday life, which you can start implementing today. I'm your host, Dr. Andrei Pikolov, MD, PhD, and the topic for today is prevention of dementia. First, allow me to share a short disclaimer. This presentation is for educational purposes only. No medical advice is given. It does not represent any solicitation, and any application of the information discussed should be done in consultation with your physician. What is dementia? It's not a specific disease. It's a general term describing impaired ability to remember, think, or make decisions that interferes with you doing everyday activities. While it's true that the most common cause of dementia is Alzheimer's disease, there are many other diseases associated with dementia. And yes, dementia affects mostly older adults, but it's not a part of normal aging. From standpoint of prevention, we look at dementia risk factors as modifiable. There is something we can do about them, and non-modifiable. Based on significant body of scientific evidence, it has been concluded in 2020 report of the Lancet Commission that approximately 40% of dementia risk factors are preventable or modifiable. Unfortunately, there is not much we can do today about other risk factors, which are not modifiable as we know them today. Let's talk about scientifically documented modifiable factors. First one is education. It has been demonstrated that those with more education, greater overall knowledge base, have more neurons, more interneuronal connectivity, and more active neuronal networks. Therefore, they can afford to lose some of the brain cells to dementia without loss of function. Good news are that it is never too late to start to train and exercise your brain via learning and acquiring new knowledge. Options are plentiful. It can help maintain cognitive function and reduce the risk of cognitive decline. Hearing impairment. There are many ways to check your hearing. It's easy and inexpensive. Any family doctor or audiologist can do it for you. And there are multiple choices for hearing aids in case you need one. Check your hearing at least once a year. Head injury. If it happened in the past, there's nothing you can do about that. This factor is modifiable in terms of prevention of head injury. Engagement in sports and activities in line with your physical capabilities. Playing it safe, using precautions in wearing hair protection, for example, helmets. Next one is hypertension. American Heart Association defines normal blood pressure as less than 120 for systolic and less than 80 for diastolic, or simply stating as less than 120 over 80. Blood pressure is easy to measure. Any primary healthcare provider should be able to diagnose and treat hypertension if you have one. Excessive alcohol consumption. The Lancet Commission defines alcohol consumption as more than 21 units per week. They counted 8 grams of alcohol as a unit. In US, we are using definition called drink more commonly, which is about 14 grams of alcohol. Calculations are getting complicated, but they fall in line with commonly accepted recommendations to limit alcohol consumption to 1 drink per day for women and 2 drinks per day for men, and no binge drinking. Obesity. Obesity is defined as an excessive accumulation of body fat that leads to a negative effect on health. Obesity is usually addressed using body mass index, BMI. You can find many BMI calculators on the web. World Health Organization defines obesity as a BMI equal or more than 30. Obesity is a significant risk factor that can contribute to development of dementia through various biological mechanisms, including chronic inflammation, insulin resistance, and vascular changes. Obesity has been linked to reduced brain volume and reduced in-brain activity. Find out what is your BMI and talk to your doctor about maintaining healthy weight through diet, exercise, and lifestyle modifications, which can help to reduce your risk for dementia and promote overall brain health. Smoking. It has been recognized as a risk factor for a number of disorders, lung disorders, heart disorders, cancer, and it has been correlated with dementia. There are a number of tools for smoking cessation these days, and it should be addressed with your primary care provider as well. Depression, and especially late life depression, has strong correlation with the risk of dementia. As a psychiatrist, I'm passionate about recognizing and treating depression at any age, not only to help with dementia prevention, but also to improve quality of life and life satisfaction for all. I'm very pleased to see that screening for depression is a part of routine annual exams. At least my family doc does it to me regularly. Depression is a treatable condition. There are many treatment options available, and if you have a concern, get appropriate evaluation and treatment. Infrequent social contact or social isolation. Regular social interactions, presence of active social network has been documented to enhance cognitive reserves and to be a protective factor for dementia. It is hard to put a dose on social interaction. It appears to be variable. It depends on many life events out of our control. On the other side, one can proactively and purposefully engage in social activities, which is current recommendation, and especially for those whose life circumstances change, leading to decrease in socialization. Physical inactivity. It is connected with multiple cardiovascular, metabolic, and other health problems, and it has correlation with dementia. It is hard to study and recommend a certain dose and type of exercise to prevent dementia, but review of the scientific publications on the topic leads to take-home message that the better care you take about your physical body, the better brain you're going to end up with. Physical activity is one of the key modifiable factors to prevent dementia. Air pollution. It might be there, and we might not know about it. Sometimes it's pretty evident: wildfire smoke, car exhaust, etc. Studies show that high nitrogen dioxide concentration, fine ambient particle matter from traffic exhaust, and particle matter from the residential wood burning are associated with increased dementia incidence. Avoid unvented indoor burning. Diabetes. The risk of dementia is increased with the duration and severity of diabetes. Screening for diabetes is now a routine for primary care, and we have a lot of tools to keep it under control. Diabetes is associated with insulin resistance, chronic inflammation, oxidative stress, which may contribute to neurodegenerative processes in the brain. Diabetes can damage blood vessels through the body, including those in the brain, leading to conditions such as small vessel disease and stroke, which increase the risk of vascular dementia. The effect of different diabetic medications on cognition or dementia outcomes remains unclear, as few studies have investigated this area. However, one meta-analysis of cohort studies of diabetes reported that cross-sectionally, people with diabetes taking metformin had lower prevalence of cognitive impairment. Get screened for diabetes and get appropriate care if needed. Sleep and circadian rhythms. Exact mechanisms by which sleep and disturbance of circadian rhythms might affect dementia remain unclear, but sleep disturbance has been linked with beta amyloid deposition, increased tau. Both are hallmarks of the Alzheimer's disease. Low-grade inflammation, hypoxia, and cardiovascular disease also have been connected with sleep problems, and they contribute to dementia. It is recommended that adults should have 7 to 9 hours of sleep per night, keeping it on regular schedule, avoiding unnecessary disruption of sleep-wake cycle or circadian rhythms. I hope this presentation gave you an idea on what current science thinks about modifiable factors for dementia and what you can do about it. Let me know what you think, what questions do you have, and see you next time. Goodbye.